Good morning, ladies. It's Carol Lourie once again, and it is beautiful here in the San Francisco Bay Area. And this is part of our empowering you with education about everything related to your health, not only about integrative and natural tools for breast cancer. And today I'm here with the Kegel Queen, Alyce Adams. Thank you so much for being here, Alyce. And a lot of women I know don't even know what Kegels are. So let's just get started with explaining everything that you do so wonderfully.
For sure. And I've heard all kinds of things like the muscles themselves, or those the Kegels, or I thought a Kegel was a sex toy. I've heard all kinds of things.
I'm sure.
So Kegel exercises are exercises for the muscles of the pelvic floor.
And where is the pelvic floor?
Pelvic floor is the next question, right? So we have this, I'm seeing a mirror image. I'm actually rather not seeing a mirror image of myself, so forgive me if I'm a little confused here. So this is a pelvis, right? This is a female pelvis, and we often think of it, when we picture the pelvis, we kind of think of it like this, but it's actually in the body at more like this kind of an
tilted a little bit.
Kind of an angle, yeah. So just to get you oriented, which again is hard for me because of the mirror thing. So here's the pelvis. This is the bottom one of your vertebrae, right? If we
look your back. This is your back. This is your back
bone. Your whole spine goes up from here. And this is the very base of the spine. So below here we have this big bone, the sacrum, and then your tailbone is here. Whoops.
Right.
Tailbone. In the front, we have the pubic bone here. Again.
You're doing great.
Then in between the pubic bone and the tailbone, we have the pelvic floor. So this is this hammock of muscle and connective tissue. Connective tissue is really anything in the body that helps hold things together, including your skin. So this bowl of muscle and connective tissue is the pelvic floor. And you can see, if we look at it from a few different angles here, it is a like grapefruit sized bowl of muscle. So
that's a lot of muscle. Even though they're small, there's a lot of different muscles there.
Yes. And one of the things that is important to know about these muscles is, so often when people talk about doing Kegels, there are so many pieces of misinformation out there about Kegels. And one of the things too is, if you've heard, pretend you're stopping your stream of urine, or actually do it. But that you're only really using these kind of even smaller muscles. There are two layers of muscle here. And if you're really only using that kind of P part of the muscles, that's the small pieces here. The parts you also need to engage is this much, much larger group of muscles. They're called the levator ani muscles. It means lifts the anus. This is the anus here. Nobody likes to talk about anuses, but we've all got one. And so you really need to engage the entire pelvic floor. And perhaps a little later, we can do one really good Kegel exercise together. Do that ourselves. But the basic idea is these muscles are doing a number of jobs in the body. And if they're not working properly, you can have all kinds of issues. So one of the jobs the pelvic floor does is to stabilize the base of the spine. We've seen how the pelvic floor is attached to the base of the spine. It's attached to your tailbone. It's attached to the sacrum, which is between your tailbone and the spine itself, right? All your vertebrae. If the pelvic floor isn't optimally functioning, if it's too tight and clenched, or if it's too loose and saggy, you can end up with instability here, which can go all the way like dominoes and lead to all kinds of back pain. Your pelvic floor has an important function in your sexual functioning. If you take a look here, the pelvic floor, you can see these muscles are surrounding your vagina. These muscles are attached directly to your clitoris. And when you have an optimized pelvic floor, you have good tone, good structure for the vagina itself, and you have better circulation to your sex organs, among other things. That's another whole topic we could talk about sex. But so the pelvic floor functioning well and being healthy is part of your sexual functioning. And another thing, perhaps the one of the most important pieces, is your pelvic floor is what decides, along with your intention, but it's your pelvic floor that decides when you go to the bathroom, when
Oh,
you pee and poo, and when you don't. So if your pelvic floor isn't working correctly, you can end up with incontinence, which is enormously popular
yeah.
problem to have, and has a tremendous negative impact on women.
So let me just back up for 2 seconds. Let's talk about the health of the pelvic floor, because my experience working with women in their, let's say, 40s to 60s to 70, especially women who have gone through some chronic disease treatments like breast cancer or any other autoimmune inflammatory disease. I'm sure there are statistics that we could look up, but it doesn't really matter, that X% of women who have gone through breast cancer treatment have pelvic floor dysfunction, or
Mhm.
compared to X% of women between certain ages who have pelvic floor dysfunction. And I think that this must be a very underdiagnosed problem, because women are not talking about it,
Mhm.
or if they talk to their regular medical internal medicine, or even they are fortunate to get referred to a gynecologist, unless the doctor is a specialist in pelvic floor dysfunction, he or she may not know what to do other than refer you to the surgeon. So let's talk about that whole topic.
Yeah. So, well, and one thing, of course, specific to breast cancer is that women may be going through menopause at a much earlier age than they
Mm-hmm.
might have otherwise. And the part of what happens, of course, in menopause, regardless of how it comes about, is that our connective tissue gets a lot less stretchy. It gets more brittle than it was before. And that can cause issues with the pelvic floor as well. Um, one thing we didn't talk about also is pelvic organ prolapse. So your organs, your pelvic organs, your bladder, your uterus, and your rectum all nestle in here together like pieces of a jigsaw puzzle. They're all nestled down in there. And what can happen sometimes, if they're not supported properly by the pelvic floor or by the ligaments that hold them up, that help support them from the top and the sides, the pelvic floor is supporting them from behind and below. If you lose some of that support, the organs can actually sink down into the vagina. Um, so you can end up with a light duty prolapse you're not even aware of. You can end up with a really severe prolapse where you have literally a bulge or your cervix coming out from the vaginal opening. Um, and you're so right that women aren't educated about these things. They're not told. I didn't even really know what prolapse was, in spite of having half a master's degree as a nurse focusing in women's health. I barely knew what it was until I had my own issues and really started researching pelvic health myself. It's very, very much under discussed. And I think so with prolapse, women are uneducated and also feel a tremendous sense of shame if they are experiencing it. They don't talk
Mm-hmm.
to each other about it. And if they have some leaking, some urinary incontinence, they think it's normal and they don't really talk about it because it's just like, oh, yeah, this is just how it is when you get to a certain age or after you've had a baby or something. A lot of women just think this is just part of who I am now.
Right.
Um,
I mentioned that as an acupuncturist, I see this in my office quite frequently. And the whole perspective of Chinese medicine is that the qi or the energy needs to be flowing upwards. So that if after you've had a baby, it's very common because you've given all of your energy over to making the fetus and then you've pushed out the baby. But as the women here now in this community are past that, where they're older and they've been through chemotherapy, which is an extremely disruptive experience to your physical and emotional health. So it is extremely common, I would imagine, to have some kind of letting down of the vital force so that everything sort of pushes down. So we need to do biochemical, metabolic, supplements, nutrition, breathing to bring the energy back up, as well as acupuncture and your exercises to like really get these muscles back in alignment and strong. It's sort of like you have to lift weights for your arms and your legs and your bones. We have to do this for our pelvic muscles too.
Exactly. And it's so important to do it correctly. That's probably the number one, other than women not knowing what prolapse is, thinking incontinence is normal.
Incontinence is not normal, and this feeling of a plop hanging out in your vagina or pushing through into your underpants is not normal, and you need to go to hopefully a pelvic floor. You can call your gynecologist, of course, but really insist on being referred to a pelvic floor specialist, in my opinion.
Yes, and be aware that much of what you're going to hear is a recommendation for surgery.
Oh, let's just get you scheduled for surgery. Oh, let's just put you on antidepressants. Oh, I love this. Oh, let's just beginning of the sentence.
Yeah, because what you need, I mean, and I have free information you can get. Carol's going to help you get it, all about what you can do that isn't surgery. So we don't need to delve into that here.
No, we're not going to discuss that.
The point is, there's a lot you can do that isn't surgery, but you're not going to hear about it at the doctor's office.
So let's talk about how women can do this correctly.
Yeah. So some of the big Kegel myths that you may have heard, a lot of women have heard this 200 Kegels a day. A lot of women have been taught to do elevator Kegels. That's popular in childbirth ed. A lot of women are taught. What's that?
I never heard of elevator.
Yeah. Well, don't bother, because it's not supported by any. There's no science behind that whatsoever.
200 a day sounds a little overwhelming to me, and I would imagine women don't even get started. I don't know what elevator Kegels are. What's the next myth?
So the next myth is the right place to do Kegels is anytime you're at a red light or waiting in line somewhere. This is not correct.
You can't make this stuff up. It's so absurd. You can't make it up. The right place to do Kegels is at a red light, or if you're standing in line in a grocery store.
Right. Kegel devices, another big problem. All Kegel devices are unnecessary, and some of them can be harmful. The kind that are like vaginal weights, sometimes doctors prescribe those, or you can buy any one of 100.
Don't spend your money, ladies. Do not waste your money.
Kegel devices will frustrate you and end up in the back of your underwear drawer. And as I say, the ones that are
or the trash can
could hurt you. And then this idea that, like, if you were going to do 200 Kegels a day, you're doing them like this kind of thing. That is not the effective way to do Kegels. If you're, let's say you want to build your biceps, there are different kinds of workouts for different kinds of effects. Like a track star is going to train differently from a weightlifter. There's different ways to use your muscles. And if we want the benefits of making these muscles thicker and more firm and toned and sitting higher up in the pelvis, as well as better control and better strength, all those things that get the therapeutic effects we're going for, We need to do Kegels in a very, very specific way. So let's do one together, you and me, Carol. And
You got it. I'm just writing how to do Kegels in a very specific. Okay, I'm ready. Go ahead.
All right. And this is for you and me, Carol, and you at home also.
You at home and you on YouTube and you in my community. Everybody take advantage of Alyce's expertise and let's uplift.
Okay.
Okay, I'm ready.
All right. So here's how we do it. I call this the movie star exercise. So close your eyes if you would. And I want you to picture your favorite movie star, whoever that is, someone you'd really, really like to impress.
I don't have one, but go ahead. Can I picture like the ocean or the forest? Does it have to be a person?
It has to be a person. It has to be a person and someone you really, really want to impress.
Okay.
Some sort of hero to you. I like to think of Denzel Washington. That's my go-to. So you and Denzel or whoever are together for dinner. You're at a quiet corner of a restaurant all by yourselves. And Denzel, whoever it is really opening up, telling you a really personal story. And
how about your spouse or significant other?
What's that?
How about your spouse or significant other?
No, this has to be somebody you want to impress.
Okay. Why? I am curious.
Somebody who's not familiar to you, but somebody you don't know and you want to know and you want to impress this person.
Okay, go ahead. So we have somebody I want to impress, and then what happens?
And the conversation is becoming intimate and getting really interesting, and you don't want to mess it up. You're listening raptly in this quiet restaurant, and all of a sudden, out of nowhere, you have an overwhelming urge to pee and pass gas at the same time. So hold it back. You cannot ruin this moment. You want to hold that back as strong as you can. And then let that go completely. That is one basic Kegel. And I want to point out there are 4 things about that make it a good Kegel. That the 4 things you've got to have. The first is that you are doing a strong contraction. It's not these little wimpy little pulses that you can do while you're having a conversation or whatever you might be doing simultaneously. People are like, oh, I'm doing them right now. That means you're not doing good ones. It needs to be a strong contraction because that's the only way to activate the necessary type 2 muscle fibers that are going to give you the changes you want. So strong contraction, that's number 1. The next thing is it needs to be a sustained contraction. The same way if you're doing bicep curls with a weight, you don't do like this all day. You get your weight and you do a nice slow, controlled curl and a slow, controlled release. It's that deliberate, sustained movement that generates those muscle changes we want. Another thing is, as we mentioned before, it's not about your don't pee muscles. You're also engaging the biggest, most important part, well, not more important, but the biggest part of the pelvic floor is these levator ani muscles, lifts the anus. So you're pretending that you're also holding back gas, you're engaging those muscles, and that's the biggest, strongest part of the pelvic floor. And then the 4th thing that people don't talk about, and even though I talk in my program about this until I'm blue in the face.
Right. People need to hear it a lot.
It's still tough for women. The 4th thing is relax completely. A Kegel contraction is half of what you need to do. The other half, or even the other 60% of what you need to do is really good relaxation. Because if you think about any muscle in your body, like let's say you're working your shoulders, you don't want to just tense them. Then you end up miserable, right? With muscle spasms or pain, or you can't move properly because they're so tight. We really, really want to keep the pelvic floor supple and stretchy. And like any other muscle in the body, we don't want it tight and clenched. We want it to flow and move. So that deliberate, totally focused relaxation is absolutely key.
I can see where women would have a hard time with that, focusing and bringing up and then exhaling and bringing down.
Yeah, and you don't want to push down ever. That's another really important part, but you want to allow opening and relaxation and coordinate with your breathing. And it's there are a lot of, it's not complicated, but there are a lot of pieces you need to get just right in order for Kegels to have a therapeutic effect that you're looking for. It breaks
very interesting. I mean, there are a lot of components to creating this.
Yes.
And so I want to talk about, okay, we have that pulling up and holding in, and then what's the difference between pushing down and relaxing, and then just, I think there's this tendency when you relax to just sort of push it down, and that's opposite of what we want to do. We want to bring the energy up.
Exactly.
I think that's a really hard skill set for women to figure out how it feels.
Yes, and part of that, I'll just kind of like take that a little deeper and say one reason we have so much trouble, I mean, there are a lot of reasons that we have trouble kind of connecting with the pelvic floor. One is it's not like your hand or your biceps that you can see. You know, it's a body part that's hard to actually see. The muscles are visually hidden, even if you can see that part of your body. It's not like your biceps where you can kind of see what's happening there. That's one thing. But then there's all this cultural mystery around these body parts. There's all this shame. There's often trauma. I mean, there are so many reasons that we don't grow up and go through our lives with a super open and healthy and connected relationship with this part of the body. So having that as a factor on top of simply not having been trained in how to move the muscles, it's a bit of a hill to climb sometimes.
It is, especially the trauma part, I think. And
huge.
A lot of women have had surgical interventions, and even when surgery is done in the best of environments, it can be very traumatic.
I think surgery is inherently traumatic, even if everyone is very kind and it's the best possible situation. I don't think it's possible to not have someone cut your body open and have there not be some degree of trauma with that.
Yeah, I agree.
I lost the thread, Carol. Where were we? I started, about how people connecting and the difference between pushing and
relaxing.
So the best way that I can explain the how to relax without pushing is using the breath. So I'm going to stand up and try to have you see me here. So
great.
You can't see really all of me, and my camera's distorting me, but here's my respiratory diaphragm, right? When I breathe in, it goes down. When I breathe out, it goes up. And here, here's my pelvic diaphragm. Right. Here's my pelvic floor down here. In between is like a water balloon filled with my organs.
Right. Your abdomen. So, yeah.
When I breathe in and I expand my lungs, I'm pushing on this water balloon and creating just a very, very gentle pressure against the pelvic floor. I'm not doing heavy pressure like a crunch. I'm not doing like a Valsalva, like a hold your breath and push kind of move. I'm just expanding my lungs and creating ever so tiny pressure against the pelvic floor. from the inside of the body.
Mm-hmm.
And that can help. Using your breath that way just offers the teeniest little bit of pressure. And if you can combine that gentle, helpful pressure with consciously relaxing those muscles, that is the best way to generate that just little bit of stretch that you need. People, there's talk about like do downward dog or squat or something to help open the pelvic floor, and those things are fine too. But if you aren't mastering the simple relaxation phase without doing a whole exercise to do it, that is really the foundation of creating relaxation, is making that connection. And it does take practice sometimes. Some women get it more
Imagine.
than others.
Yeah, I would imagine it takes practice, because for me, the relaxation is, I think there's too much of a tendency to do a little push, and that's not what we're talking about. The inner pulling up isn't so bad, but it's like letting go is difficult.
Yeah, it's letting go and feeling safe to let go is part of it, particularly women who are struggling with prolapse and they feel all day like they have this heaviness, this sense of like, I feel like things are going to fall out of me. Even with mild prolapse that you don't even know you have, you might have that sensation.
Mm-hmm.
But if you have that sensation, there's this even more of a like emotional and psychological to pull up.
Right.
And when we clench, the muscles are not as effective. A clenched muscle is not optimal. It's not as strong as it should be. So we really want to work that supple relaxation part in. It's absolutely key.
So I want to say to the ladies who are listening to this live, and those of you who the goddesses have brought you to listen to this later, healing a prolapse, in my opinion, it takes a multidisciplinary approach, utilizing functional medicine, because everything's connected in your body, and it's not just your sagging muscles post childbirth, post breast cancer treatment. There's a lack of vital force in your cells, and we need to do functional medicine to give you certain supplements and make sure your diet is really dialed in. And I would find you a local acupuncturist to get treatment because acupuncture has very specific points. There's a point right up here at the top of your head that brings up your energy, and there are other points that we do. So you don't have to suffer needlessly with prolapse. So Alyce, I'm going to put here in the chat, and this will be sent to my list if you're part of my community. How can women find you on the internet?
So I think you have a link, Carol, that you're going to be posting, but
I know, but why don't you just tell me, so I'll just put it right here.
Yeah, women can always find me at kegelqueen.com. And that's KEGEL queen.com.
Right. Great website. That's wonderful. Any last words that you would like to share with the community, Alyce?
I just really, if there's one thing that I really want, there are so many things I really want women to know, but mostly, if you're suffering with any kind of pelvic floor issue, know that it's not just you, and that this is a very much under-discussed issue, even with women who are otherwise very close with each other, sisters, good friends. Even women who really talk about a lot of things often don't talk about these specific pelvic health issues. So number one, you are not alone. And number two, your doctor is going to offer a very limited set of options. And there's a lot more out there than you are going to hear about at your doctor's office. So
that's why you're here.
Yeah. Yeah, absolutely.
So are there physical therapists that specialize in pelvic floor disorders?
Absolutely. Yep. They're sometimes they're called women's health physical therapists. Sometimes they're called pelvic floor physical therapists. But yeah, they're out there. And it's interesting because in all the years that I've been doing this, I hear about the whole range. There's one practice in my community that people just revere. And I know people have been there and, I think they're fantastic. Then I hear stories from women about their experience that is at the very opposite end of the spectrum. So I have seen that there seems to be very little consistency
Yeah,
in these PTs and the quality of their training, and they're not really consistent protocols at all.
right. That's been
So
my experience. I've had women who have been traumatized by pelvic floor PT practitioners who have their hands in their vagina and are working on the muscles and everything, and that's been extremely traumatic. So how can women make sure that they're going to somebody who is qualified? I mean, that's part.
yeah.
I mean, and if you don't feel comfortable with that, ladies, you don't let anybody do that to you.
Yeah, absolutely. Now, I will say that sometimes that like trigger point massage to the pelvic floor can be a great thing. But like any physical or like any treatment of any kind, it has to be performed in a way that's going to be generative and positive for you, not in a way that traumatizes you. For heaven's sake,
Yeah.
that let's consider that a baseline.
And you don't just meet the person and then next in 10 minutes have their hands in your vagina. I think there needs to be a strengthening and a repair before you, and trust develop before you let this person do that to you.
You absolutely have to trust anyone who is doing anything inside your vagina. That is
Mhm.
incontestable.
Yeah.
Absolutely.
And if you don't feel comfortable, no matter what, and if they say, well, you have to do this or else you're not going to get better, that's a moment when somebody
Mhm.
says you have to and you're not going to. That's a moment where you leave that office, because that's not an appropriate way to speak to anyone, right?
Yeah. Yeah. I mean, there are so many things to ask any practitioner that you might see, and just getting a feel for, what's their training? What do they consider good care? Why would they say come to me instead of somebody else? How long have they
Hmm.
been doing it? What do they consider the top three things about the what guides their practice? If you should be able to get a decent perspective on someone's philosophy at least, and their skill level, by just asking them some basic questions like that. And with something like PT, you're awake. It's not like a surgeon. You could talk to a surgeon all day and you can't really assess their surgical skills very well, whereas with PT, you're there, conscious in the room. You can see and experience what they're doing. So I think simply asking any questions is a start that a lot of women, that's a step a lot of women don't take. They just kind of get a referral, they show up. Um,
And that's not how I encourage women to act.
yeah,
That's not an empowered approach to health recovery or an empowered
for
approach
sure.
to their life. I mean, we have to remember that we are employing these people.
Yeah,
So, you want to make sure that this person has certain credentials, and you want to feel energetically that they're a good match for you, not just, oh, my gynecologist referred me to you, so I'm assuming you're fine,
right.
right?
Yeah, absolutely. And I really think your point before, that the trust and the emotional side of having anything to do with these body parts is huge. It's
Mhm.
enormous, and there is no body part that matters more in that way. So that the relationship side
Well,
of your treatment
female
is
body
huge.
parts, the breast, yeah. Yeah, they're all connected. I mean, they're very sacred parts of who we are, and you have the power to say yes or no to anything, ladies. So it's important for you to remember that. So
Yeah,
Alyce,
absolutely.
thank you very much for being here. And all of Alyce's links will be posted in this chat. And thank you again for spending time with my community and for doing what you do and helping women empower their lives for recovering their health and living a life of joy and freedom.
It is my pleasure. Thank you so much, Carol, for allowing me to talk to your folks. I really love talking to people and spreading the good word.
Thank you. Have a lovely day. Alyce, hang on here. We're going to just talk for 2 seconds. Ladies, thank you so much. It's been really lovely to speak with you. And Alyce has a really important message. I hope you all listen and then go to her website, kegelqueen.com. And this is Carol Lourie signing off for now. There'll be more later. Have a lovely afternoon.